you brought up a good point about, sexual response. And think of it with women with overactive bladder, they don't feel good in the floor and
Hmm.
they don't feel like having sexual activity. They're so overstimulated. So utilization of this device, talk to us about like, how does it work? Is it down regulating the system? Is it soothing the system? Like what is the response? Because, you think about sexual health, a lot of women with overactive bladder don't want anyone touching them anywhere in the neighborhood because it's so agitated.
Well, in general, in my practice, in my realm, Urogyn realm, a lot of people just body image and confidence is the number one thing that goes when they are consciously aware of some kind of problem, whatever it is, whether there's so
Mhm.
many categories of where people may or may not actually have real problems, or they may just feel like they have a problem. That is the
Yeah.
ultimate inhibitor of sexual response, because
Mhm.
those reflexes, you need to be in a relaxed state for the autonomic nerves to amplify sexual response to the point of threshold of, the next
Mhm.
stages that kind of take over.
Mhm.
And so when people are distracted by anything, they inhibit their own ramping up of response. Even with urination, right? Like people really worry, and you know this as a physical therapist, they'll worry that, I don't have a good flow. And then they sit there and they focus on the stream and they think about if it was more than last time, or sometimes they count the seconds or measure the volume. And
Yeah.
the more they think about it, the more they're inhibiting their own autonomic nerve's ability to drive micturition. And sexual response is the same. If you're thinking about it, you're not
Mhm.
relaxed enough for the autonomics to do their thing in
Mhm.
an inhibited way.
So does the wearable device kind of then get more relaxation, like to the tissue itself, or just down regulate the nerves, or all of the above?
Neuromodulation isn't that well understood. I mean, we know safe and effective treatment regimens, and we know, it's better for stress incontinence to use this frequency and better for urge to use that frequency. But exactly what is happening is sort of difficult to say, because nerves are always communicating. There's a cascading of events where it may amplify what you may stimulate one nerve, but that nerve also inhibits some other nerve or activates another nerve it's connected to, or works through interneurons at the level of the spinal cord, to do things. So we put energy out there. We know that OAB improves with pelvic stimulation using certain frequencies and currents, like I said. But exactly what's happening, especially with autonomics, it's difficult to say. The truth is that even sacral nerve stimulation, which has been around for 25 years, and it's like the gold standard treatment for refractory overactive bladder. I asked one of the original folks involved in this, an older man, and at a European international conference about, S3 is a somatic and autonomic nerve root, right? It has both fibers. And which is it? Is it the somatic effect
Mhm.
of the stimulation at that location, or is it the autonomic? And we couldn't really answer.